Welcome to my channel. I am Renewal, and today I want to take you through another health topic. And as we still celebrate this Christmas, I want to take this time to wish you all a Merry Christmas and a Happy New Year. Today, what do I want to talk to you about? Today, I want us to talk about HIV. HIV. And I'm sure everyone has heard HIV before. It simply means human immunodeficiency virus. Human immunodeficiency virus. Human, you and I, human, we are human. And also immunodeficiency, our immune system, what keeps us healthy. Deficiency means we lack. So the moment immunodeficiency is in, it means the immune system, what keeps you healthy, is lacking something. And virus, we all know viruses are microorganisms that replicate itself and is so harmful to the living organism, any living organism that it attacks. So when we say HIV, what do we mean? HIV is an infection that attacks the human immune system. It targets the white blood cells and weakens the immune system. That leads to a whole lot of things, including these like tuberculosis, infections, and cancer. So the moment one acquires HIV, the viruses begin to attack the person's immune system, weakening the immune system, exposing you to all sorts of sickness that I stated over here, which include tuberculosis, all sorts of infections, STIs, and any other infections, and also cancer, and many more. Causes of HIV. There are a lot of ways one can contact HIV, and it includes sexual contact. You all know when an infected person have intercourse with someone who is not infected, the HIV can be transmitted through the semen or even by a cut in the V place of the woman, and someone can get the HIV. And also from mother to child during pregnancy, childbirth, or breastfeeding. When an infected mother has HIV and doesn't visit the hospital for her medication so that it will prevent the unborn child from getting the HIV, it can easily be transferred to the baby. And when the mother also give birth during childbirth, and carefulness is not also taken, an unborn child that is about to be given birth can also get the HIV. And also during breastfeeding by an infected mother who is not taking the precautionary measures serious. So when you are pregnant and you have HIV, you need to quickly visit the hospital so that the necessary education will be given to you, as well as the medication that will help your unborn child prevent or avoid getting the HIV and AIDS. Also by contact with blood, infected blood, contact with infected blood. Let's say someone had a cut on the skin, and maybe you have already a sore on your body or any part of your skin, and you also contact the infected blood. The virus may or might swim inside your sore, leading to they infecting you, and you can also get it from there. And also sharing needles or sharp-edged instruments, example blade, by an infected person. When you use an instrument, a sharp-edged instrument that has been used by an infected person, and assuming it cut the person and blood got transferred onto the sharp-edged instrument, and you are not aware, in case you also use it and you have a cut, it might transfer into your sore, leading you to contacting the virus. And also through blood transfusion of an infected person, when you are being transfused with blood that was not well checked, and let's say it has HIV virus in it, it might also lead you in acquiring. Okay, so let's talk about people who are at high risk of getting HIV/AIDS. When we talk of people who are likely or are most likely to get HIV/AIDS, we talk of people with history of sexually transmitted infection, including hepatitis B, or hepatitis C and any STIs. That is people who constantly get STIs and people with history of Hep B and Hep C. They are at risk of getting HIV because it already the immune system is weakened. Also, when we talk of people who are at high risk of getting HIV, we talk of people who have had multiple sexual partners. I'm talking of people who are promiscuous, people who are not faithful to their partners. You are high risk of getting HIV if you are living such life. We talk of people who have been raped by an infected person. So assuming armed robbers or boys gathered and rape someone who they are infected, they might affect the person through the semen release or maybe a cat. Yes, or the lady too, assuming she has HIV and the one raping is not even having it. Through cat, she might transfer. And also we talk of people who have received blood transfusion that was not strongly screened. So if you want to receive blood transfusion or you want to donate blood to someone, ensure that your blood is screened properly for HIV so that they will know that you don't have the virus in your system. Because if you don't do that, you can or you might transfer HIV virus to an innocent person. Okay, so we are coming to talk about signs and symptoms of HIV. When someone acquires human immune virus, what are the signs and symptoms you will know? Some of the signs and symptoms include fever. You will feel feverish. Some signs also include skin rashes. Some signs also include headache. It can even lead to severe headache, and some include sore throat. So when you are there and you are feeling all these things, you can visit the hospital to do a checkup so that you know whether it's HIV or it's a different thing. And as the immune system progresses weakening, as the virus stays in the person's system and is not really treated, it can lead to swollen lymph nodes. It can also lead to waist loss. That is the commonest one in everyone that is basically seen when people get HIV. It can also lead to diarrhea. Constantly, you will realize you are having running stomach, you are having diarrhea, and also it can lead to cough. So you have to also ensure that when you are feeling all these signs and symptoms, after you felt this, you visit the nearby hospital. And also, when the HIV is in the person's system and is not treated, without treatment, the condition will develop into these diseases, which include tuberculosis, Cox postulates, and also cryptococcal meningitis, that is virus spreading from the lungs to the brain, and also severe bacterial infection. It can, like something like gonorrhea, syphilis, chlamydia, all the STIs, it can be severe in the person's system, affecting and harming the person's body. And it can also lead to cancer such as lymphomas and Kaposi's sarcoma. And also, it can also lead to hepatitis B and hepatitis C. So you have to take all these signs and symptoms serious. And when you are, your body is exhibiting all these signs and symptoms, kindly visit the nearby hospital. It can be HIV or it can be another thing altogether. So we are coming to talk about prevention of HIV. When we talk of prevention of